COVID Circle is the COVID-19 Research Coordination and Learning Initiative. It's a partnership between the UK Collaborative on Development Research, UKCDR, and the Global Research Collaboration for Infectious Disease Preparedness, GLOPIDAR. It aims to align research funders and researchers towards a coordinated effort to support research in, for, and with low and middle income countries. There are 4 key elements to COVID Circle. Firstly, COVID Circle aligns global research funders to 7 key principles for supporting high quality research for the most pressing global needs in epidemics and pandemics. We also want to ensure that funding decisions are supported by awareness of and alignment to WHO's global research agenda for COVID-19 and importantly, locally defined research priorities. COVID Circle also maps ongoing COVID research projects. UKCDR and GLOPIDAR developed an open access live tracker of COVID-19 research projects, along with quarterly analyses to enable funders and researchers to identify research gaps and opportunities, and also to inform future investments.
Coordination between researchers is extremely important during an epidemic or pandemic. Through COVID Circle, we will support researchers to connect and collaborate, access relevant resources, news and events, and engage with a broader networks to maximize the impact of research on COVID-19 in low resource settings. Lastly, we want to ensure that we learn from the process of both undertaking and funding research during the COVID-19 pandemic to inform future responses. In particular, we want to understand how to overcome barriers researchers and funders encounter to ensure effective research during epidemics and pandemics.
The COVID-19 pandemic and its rapid spread across the world has resulted in an unprecedented research response. It has highlighted the need for coherent and strategic funding to support innovative and effective research to the ongoing pandemic and preparedness for future epidemics. From the beginning of the pandemic, the importance of a coordinated global research agenda was recognized, resulting in the development of the WHO research map for COVID-19. As the pandemic has progressed, the need for coherence remains crucial to ensure that the most important research priorities are funded and to identify remaining research gaps. This is why the COVID Circle initiative, developed in partnership between UKCDR and GLOPIDAR, is extremely valuable. COVID Circle ensures that there is increased collaboration and coherence among both funders and researchers to support COVID research in and for low resource settings.
So the COVID-19 Research Project Tracker, which we developed as part of the COVID Circle initiative, is a living database of research projects across the world that have been mapped against the WHO R&D priorities, which were set internationally. And it's a really important resource because it allows researchers and funders alike to understand where there might be persistent gaps, where there might be areas of duplication, and therefore it allows us to collectively deliver a more coherent global research response against COVID-19. In addition, we have also developed a living review, which provides cross-cutting analysis across the database to understand certain themes and certain areas in more depth at a particular relevant time, for example, on long COVID, capacity strengthening, or any other areas that might emerge. Another important area of the initiative has been the development of the 7 principles to strengthen funders' research response to the current pandemic and future epidemics or pandemics, because the way in which we fund is just as important as to what we fund. And so these principles will remind funders of important things to consider, such as ensuring that research meets demand, ensuring that whilst we are responding to the current pandemic, we're also preparing for future ones, and so we're strengthening capacity to respond in the future, that we're safeguarding communities and researchers and participants alike in our response, and that we are sharing data and that we're collaborating to ensure that we have a more effective response. So effectively what this initiative is doing is it's allowing us to have a better, more coherent response to the current pandemic, but also it's preparing us to future pandemics so that we can ensure that collectively we can address any future threats.
COVID Circle is important to us as a research funder because in response to the global pandemic of COVID-19, we launched a joint funding call, the Global Effort on COVID-19 Health Research, which we call the GECCO call, which directly addresses elements of the WHO research roadmap. We see COVID Circle as a vital collaboration between international research funders to produce research which really has an impact on the pandemic as a global endeavour.
While COVID Circle is important to support our research community during the COVID-19 pandemic, we welcome the learnings that will be gained from the initiative will be beneficial to funders and researchers for years to come. We will be able to support our researchers more rapidly and respond faster to future outbreaks.